This segment of Delmarva Life is brought to you by Peninsula Regional Medical Center.
You know, we could spend the rest of the hour, the entire weekend, the rest of the month for that matter, listing reasons why Delmarva is such a great place to live. But for the next few moments, we're going to focus on one reason in particular, a groundbreaking treatment for lung disease that has made its way to Delmarva. Let me explain. This is a huge deal. This is a treatment that is only available in a very few hospitals across America. With us this afternoon, Dr. Yashvir Sangwan, who is an interventional pulmonologist at Peninsula Regional Medical Center. Thank you so much for joining us this afternoon. What we're talking about is a surgery.
Yes.
Explain it.
So here's the thing. This is one of the groundbreaking things because, as you know, I do such specialized work, but the amount of sick people I help is still very limited. This will allow us to help so many people who are short of breath with COPD, because this is a treatment where we are using a minimally invasive surgery to get rid of those parts of the lungs which are completely destroyed by smoking. So what was happening is, the first question, our public is very informed, because as soon as FDA approval happened, I started getting phone calls from doctors and patients about these valves. So I find it very necessary to know about them. So we have been placing these valves since 2005.
Okay.
In fact, in 1990s, we were one of the first hospitals in the country to participate in the initial trials for these valves. So we have a combined experience, Dr. Chasse and me, of about 22 years. So we have been doing this.
All right, so break this down for me just a little bit. Help me understand. What does the valve do?
So the valves, the first picture that you will see, will show you the valves. On the left side, there is the Zephyr valve that we are using for this new indication called COPD. And on the right side is the valves that I placed just 3 of them last week that we have been using to repair tears in the lung, so that the air does not go into the tears and collapse the lung, and the lung gets time to heal. So in the second picture, you will see that smoking destroys your lung, does not have to destroy it all at the same time. There are some parts of the lung which might be bad, worse than the others. Now these parts get all loose. They don't breathe for you, but they get loose, and they compress the parts of the lung which are not affected by smoking. So you get short of breath. Now, in this picture, you see that in the past, we used to cut out these segments doing a big surgery. And 5% of the people would actually die because of the surgery, because of how drastic it was. So in the next picture, you will see that now what we do is we identify those parts of the lung seen here in black, which are not working for you, and we identify the airways that are taking air to those parts of the lungs. And what I do is, in the second part, I'm going with my scope, and I'm simply putting these valves in those airways. And as soon as I do that, the airways start collapsing. You still have the bad part, but now it is getting smaller. And on the right side of the picture, you can see that the good part has already expanded, and the small part is decreasing.
Which gives you better breathing.
Better breathing, because the thorax is like a box, and now the bad part is a small part of the box. And the good lung expands.
Has room to go.
Has room to go.
This is really a big deal for Delmarva, isn't it?
Yes, it is a surgery which can now be done minimally invasively, and we are one of the very few centers who have already have the stuff that we need to start offering these to patients. The only thing is that the patients have to be highly selected to benefit.
You are obviously excited about this.
Yes, because this is one in a lifetime kind of things that totally change the field that you are practicing in.
So this is helping, this is part of PRMC's program, helping detect, diagnose, and treat lung cancer.
So the COPD. So this is emphysema from smoking. So what happens is that if you're a smoker and if you have COPD, you should have something called a lung function test, where you breathe into a machine and the machine tells you how your lungs are doing. Everybody gets that. I will be very soon I'll start visiting each and every practice that is around the region to tell them that if they see certain numbers on that lung function test, they need to call us. The patients then get a specialized CT scan that we feed into a machine, and the machine can tell me if there are any parts of the lung which are worse than others that I can block. If you are that candidate, you come to us and we make sure before we take you to surgery that we have exhausted all medical means of making you better. So basically it specializes the whole center. It makes you a world-class COPD treatment center.
So is this specifically COPD, or is
this is specifically COPD.
Okay.
And about 15% of the people who smoke in this area will have COPD, and about 5% will be really bad. So now we are talking about a big population of patients who can't walk, who can't shower without getting short of breath. The only thing is that they have to stop smoking for me to consider them, because you can't be smoking at one side and also getting the surgery. It just makes things worse for us.
So is this an application that we initiate, or does our doctor do that for us?
So what we are going to do is, I want to reach out everybody, not just those patients who are coming to us asking for valves, but also those patients who might not even know about this.
Okay.
So first is the TV segment like this, but the next step is to go to every primary care doctor, because they are the people who see your sickness first, and make sure that everybody knows that we are here to help, that we have the valve technology, we have been doing it for many years, and we can do this for this new indication.
Okay. Let me see if I can sum this up to make sure I've got this right.
Yes.
This valve that you have, you've been putting in since 2005.
Yes.
The valve helps collapse the bad parts of your lung to give the good parts of your lung more room to breathe.
More room to breathe. So you don't need the bad parts. They're not breathing for you. They're just occupying space and making your life miserable.
PRMC's Dr. Yashvir Sangwan, thank you so much for talking to us this afternoon. Absolutely incredible, incredible.